Hypertensive emergency is present when uncontrolled blood pressure requires immediate treatment to prevent progressive or impending end-organ dysfunction. It is hypothesized that the release of vasoconstrictors promotes a sudden rise in systemic vascular resistance, which ultimately leads to a rise in blood pressure. Possible manifestations of end-organ damage can include acute myocardial infarction, acute heart failure, decreasing renal function, and ischemic or hemorrhagic stroke. Retinal hemorrhage can also take place, causing a loss of vision. Perioperative hypertension is a common occurrence during surgery. Patients with and without chronic hypertension are likely to develop blood pressure elevations and tachycardia during the induction of anesthesia. Hypertension results through the contraction of smooth muscle cells lining the arterial wall. Contraction is in part mediated by the movement of calcium through channels found within the muscle cells. An understanding of this process led to the development of dihydropyridine calcium channel antagonists like CLEVIPREX, clevidipine, that block the movement of calcium into smooth muscle cells. Dihydropyridine calcium channel blockers are believed to have less negative inotropic effect, meaning that they can lower blood pressure without reducing cardiac output. This is because dihydropyridine calcium channel antagonists like CLEVIPREX work by selectively dilating arterial smooth muscle via calcium channel blockade, reducing systemic vascular resistance. CLEVIPREX does not reduce preload, confirming lack of effects on the venous capacitance vessels. CLEVIPREX Injectable Emulsion is FDA approved for the reduction of blood pressure when oral therapy is not feasible or not desirable, and is available as a ready-to-use pre-mixed emulsion of clevidipine, making it readily available for hypertensive emergencies without the added step of admixture. CLEVIPREX causes a dose-dependent decrease in systemic vascular resistance, an important factor in the development of acute hypertensive emergencies. CLEVIPREX delivers reliable and titratable blood pressure reduction when a hypertensive emergency requires immediate treatment. In the perioperative patient population, CLEVIPREX produces a predictable 4 to 5% reduction in systolic blood pressure within 2 to 4 minutes after starting a 0.4 microgram per kilogram per minute infusion, approximately 1 to 2 milligrams per hour. An increase in heart rate is a normal response to vasodilation and decrease in blood pressure. In some patients, these increases in heart rate may be pronounced. In studies up to 72 hours of continuous infusion, there was no evidence of tolerance or hysteresis. For prolonged blood pressure reduction, transition patients to oral medication as soon as their clinical condition permits. In most patients, full recovery of blood pressure is achieved in 5 to 15 minutes after the infusion is stopped. In studies up to 72 hours of continuous infusion in patients that were not transitioned to other antihypertensive therapies, there was some evidence of rebound hypertension following CLEVIPREX discontinuation. Indication: CLEVIPREX, clevidipine, is a dihydropyridine calcium channel blocker indicated for the reduction of blood pressure when oral therapy is not feasible or not desirable. Recommended dosing: CLEVIPREX is intended for intravenous use. Titrate drug to achieve the desired blood pressure reduction. Individualized dosage depending on the blood pressure to be obtained and the response of the patient. Initial dose: initiate the intravenous infusion of CLEVIPREX at 1 to 2 milligrams per hour. Dose titration: the dose may be doubled at short 90-second intervals initially. As the blood pressure approaches goal, the increase in doses should be less than doubling, and the time between dose adjustments should be lengthened to every 5 to 10 minutes. An approximately 1 to 2 milligram per hour increase will generally produce an additional 2 to 4 millimeters of mercury decrease in systolic pressure. Maintenance dose: the desired therapeutic response for most patients occurs at doses of 4 to 6 milligrams per hour. Patients with severe hypertension may require doses up to 32 milligrams per hour, but there is limited experience at this dose rate. Monitoring: Monitor blood pressure and heart rate continually during infusion, and then until vital signs are stable. Important safety information. CLEVIPREX clevidipine injectable emulsion is contraindicated in patients with allergies to soybeans, soy products, eggs or egg products, defective lipid metabolism seen in conditions such as pathologic hyperlipemia, lipoid nephrosis, or acute pancreatitis if it is accompanied by hyperlipidemia, and severe aortic stenosis. CLEVIPREX is intended for intravenous use. Use aseptic technique and discard any unused product within 12 hours of stop or puncture. Hypotension and reflex tachycardia are potential consequences of rapid upward titration of CLEVIPREX. If either occurs, decrease the dose of CLEVIPREX. There is limited experience with short-duration therapy with beta blockers as a treatment for CLEVIPREX-induced tachycardia. Beta blocker use for this purpose is not recommended. CLEVIPREX contains approximately 0.2 grams of lipid per milliliter, 2.0 kilocalories. Lipid intake restrictions may be necessary for patients with significant disorders of lipid metabolism. Dihydropyridine calcium channel blockers can produce negative inotropic effects and exacerbate heart failure. Monitor heart failure patients carefully. CLEVIPREX is not a beta blocker, does not reduce heart rate, and gives no protection against the effects of abrupt beta blocker withdrawal. Beta blockers should be withdrawn only after a gradual reduction in dose. Patients who receive prolonged CLEVIPREX infusions and are not transitioned to other antihypertensive therapies should be monitored for the possibility of rebound hypertension for at least 8 hours after the infusion is stopped. There is no information to guide use of CLEVIPREX in treating hypertension associated with pheochromocytoma. The most common adverse reactions for CLEVIPREX, defined as greater than 2%, are headache, nausea, and vomiting. Please see the full prescribing information for CLEVIPREX at www.cleviprex.com.